part of Guwahati by the Brahmaputra, Janitva IVF brings new hope to families dreaming of parenthood. With advanced technology, expert care, and personal attention, every journey is guided with love and trust, serving families across Northeast India and beyond, because every story deserves a happy beginning. Don't miss a Doctor's Live on NLTV, Saturday 5:30 p.m. with Dr. Arpita Sarmah, MD ONG, IVF Consultant, Janitva IVF Center. Learn about IVF infertility and the path to parenthood. Guwahati thakia Janitva IVF to bishi family nimite ekta nutun umeed ase kunkan ama baba hubule sapna dikhi ase. Modern technology, experts, doctors are bishi bhal dekhbhal logode idu suffer bharosa aro care bra borta ase. Northeast India aro aspas laga desh tak seva kore. Kilimane sob kahani te ekta khushi laka shuruat deserve kore. IVF mikan in vitro fertilization or parenthood laga journey palbra jani bole Saturday 5:30 p.m. day Naglin TV ke join kuribi Dr. Arpita Sarmah, MT ONG IVF Consultant, Janitva IVF Center, Taibra, IVF fertility treatments opor expert insights share kuriya honibo.
Hello viewers, someone again Naglin TV, the Doctor's Life te swagat korise. American jobber Dr. Arpita Sarmah, IVF Consultant, Janitva IVF Center lokot mohan women's health or fertility la topic te kota koi dekhse. Jobber la episode te Dr. American ke cyst or fibroids idu la topic te fertility lo chura idu khan la topic te janaise idu nishina aro continue korina mohan aji idu logote hi juran, but then very important aro nutun topic te mohan continue korina Dr. Lot kota koribo to ahibi Dr. Lot kota koribo. Welcome, Doctor.
Thank you.
So, American last episode te mohan cyst aro fibroid lo de kota kori dekhe to idu lo de man continue korina moi apne ke ekta question hodo munjai fertility lo de jura menopause pe ekta very important case ase, but then many times in a way like ajikali la situation de people like me or similar age manukan, we know what menopause is. Man, we have an understanding like overall so doctor bajana nishna na janilwi man we have certain idea like okay menopause itu se man ingay ta idea take, but in gabi case ase they still kumba parents kan do menopause na jane, like let's say they are in their 40s or something, but then tahan menopause la do iman idea do na what is that kuina na to itu what is menopause apne parlo bujai do paro so that the audience can understand what is menopause.
If your menses are stopped totally for 12 months, 1 year, then we call it menopause. But if it is occurring in between like spotting also, so that's also not menopause. If it's totally stopped for a year, then we call it menopause. Usually the age is after 40. After 40 in India, it's around 45. Okay, average age is.
So in our shugulu, let's say apne condition 40-45 la beach de the menopause period to shuru ho jai. Then if let's say like the person is 45 ase makito aro tai certain periods karni, let's say 6 months karni type periods ahna aro type periods aishe, but then like very less periods inga aishe, then again aro type period ahna to inga situation tai shiglu to idigui menopause ko bo na itu
then we call it perimenopausal. Means there is a period of perimenopause around menopause. It's around 2-3 years. Okay, so she will have irregular periods. She will stop for a period of 2 to 3 months. Again, she will have a period of for like 1 week, 15 days. She will have heavy flow. Okay, then again she will have irregular periods. So that's a period of perimenopausal period when she will start having this one irregular periods.
Okay. So how can a person know that tayo perimenopausal period tayo siguro? Naman like, is there an age ki like, okay, mo iman age siya, or mo la periods la cycle na lui situation do inigase. Kuli do tay, can she diagnose herself as perimenopausal or how is it?
See, after 40, after 40, menopause can occur at any age. Okay, but if the symptoms are happening before 40, she should go to a specialist and see why the cycles are irregular. It's not common actually before 40. So before 40, if she is having those kind of symptoms, we call it early menopause. It should not happen actually.
Okay.
So after 40, it's common. The perimenopausal period starts before menopause. 2 to 3 years before menopause. So if she is now 42, she might have this kind of symptoms now. That is age related. Okay, but if she is having before 40 this kind of symptom, it's not age related. So there might be some other kind of problem also. So better she goes to a specialist and just consider that why this cycle changes are happening.
So like let's say amni condition to menopause no hagide, you go through 2 stages, that is early perimenopause and then you go through that perimenopause, then you come to the menopause part, like in stage wise amni idu period to cross kore. To symptoms to sopla semi thage na alag alag thaigo na, or like what are the symptoms that like okay mui itu huise and now I should go like inga type, are there any symptoms?
First symptom to this one is cycle irregularity. She will miss her periods like at a certain age after 40. That is common actually. And she will have some kind of pain also because the calcium metabolism will be very low when she will be perimenopausal. So she will have some kind of knee pain, ankle pain, elbow pain. So some kind of pain will be there. Okay, then some kind of hot flashes will be there. So there will be kind of hotness around her neck and head region. This is very common in perimenopausal. This is the first symptom. Most of the women, not all, but 90% women will experience this symptom. Hot flashes. Then sleep loss. So she will have some kind of insomnia. She will she'll be waking up at 3 a.m. like that suddenly with hot flashes. Then tingling sensation in the this foot area. So those kind of some symptoms she will be experiencing during the perimenopausal period. These are the kinds of symptoms that will tell her that okay,
now I'm
towards my menopause. These are the physical symptoms she will be experiencing, and she should go to a specialist. And there are very good medicines nowadays to relieve these symptoms, perimenopausal symptoms.
So that menopause can be same symptoms as perimenopause.
This will aggravate.
Okay.
If she is not taking any medicines to relieve during the perimenopausal period, this will be very this insomnia will increase. She will not able to sleep. The pain will increase because once she is after 40, she should automatically start this calcium actually. And she should include calcium in her diet. This milk products, those foods that are rich in calcium, she should include, because if she is not including calcium in her diet, then it will aggravate after menopause because calcium will be least in her blood. So bone pain will be very severe. The knee pain, elbow pain, she will not able to walk also. So those kind of things will be increase. So when she is 40, around 40 and after 40, the calcium should be there in her diet, and also she should take calcium tablets also to replenish the calcium in her body.
Then idu menopause hushe perimenopause stage par hushe menopause pungshe the symptoms to once you like let's say apni fully menopause period age te that period te pungshe kole that symptoms whatever was there idu khatam hobo na idu just like lifelong hui jabo apni like the symptoms.
No, they are very, very good medicines, I told you na, that will relieve her symptoms. But if she starts before menopause na, then her menopause will be very smooth. The period of menopause will be very smooth na. If she starts before that 45 like that na, and she should include little activity also, physical activity, like walking, some strength training exercises also, yoga, she should include. Otherwise the joints and all na become very loose like that na, she will have little fractures also. Once she falls on the floor also, so she will have little fractures also, because her bones will become very weak if she is not prepared for that phase.
Yes. So these things brings me actually to man medically man advanced naman painas na there are so many medicines or treatments available now. Is there anything that we can delay menopause? No,
That is genetically determined.
Or is it so? There's nothing like
no,
medically
nothing like, because
done.
some women are there, they are still menstruating at 52, 55 like that. Okay, and there are certain women, they are menopause at 40 years, 38 years. So this is genetically determined. If your mother is it's in your genes. You cannot say I will become menopause at 50. No, your genes will be there. So you decide at birth. So when you are going to be menopause,
the
actually.
genes that you come with,
it's in your family. It's in your family.
Then idu like a sushugule to man lifestyle let's say delay do man genes la hisab te man delay howa, but man kinga ko idu mala activities like our lifestyle, okay, man la lifestyle man kinga thai ki khai ki kore itu ba man la kya menopause ke effect kro na kro. Let's say example effect kurbo as in like theory I believe like but due to our lifestyle juli I just inga type nishna case thagu or can it happen?
Early menopause.
Yeah, yes.
Early menopause can occur if it's occurring before 40 na, that is also genes.
Okay, so not because our lifestyle.
Yes, lifestyle can affect if it's severe smoking is there.
Okay.
So chronic smokers na, chronic alcoholic women, they get menopause early.
Early.
Yeah.
So even
so
though
smoking destroys your eggs. So once you have a less number of eggs, so then you will have menopause at an early age. Okay. So smoking and alcohol and certain diseases like autoimmune diseases, like if you are diabetic, chronic diabetic, then some autoimmune diseases like rheumatoid arthritis, SLE, severe thyroid problems, those diseases also cause early menopause. Okay, these are different situations. Otherwise it's only genes, but those patients also should be very aware about their fertility. If they are chronic diabetic, chronic thyroid patient, they should plan pregnancy very early. They should not delay actually, because they are going to have menopause early. Yeah.
Okay, because maybe not only because of your genes, but because of
this autoimmune system, autoimmune diseases, they will cause menopause before 40.
Okay, then Aro, this brings me back to another question. Let's say that a person is going through perimenopausal or let's say a little early, not in that type of situation, then the period there, the pregnant whole chances. How is that?
Very less chances of getting pregnant naturally. So after menopause, pregnancy is possible nowadays through IVF. Okay, if she got married later age, or if she is expecting a second child and she is already menopause, it's possible with IVF. What we do with menopause, what happens there is no egg formation. Okay, now ovaries are not producing eggs, that's why you are menopause. Okay, so what we do in IVF, we take the help of egg bank. We replace the eggs, so we take donor eggs, so we do IVF with her husband's sperm. We form the embryos outside, that is called IVF, in our embryology lab, and we put the embryos into her uterus. But before that, we put her on hormone therapy. So she will now menstruate with our medicines. That will be artificial menstruation.
Yes.
But the uterus will become functional.
Okay.
So we can make the uterus young at any age. Whether she is 60, 65, we can make the uterus young. But we cannot make the ovaries young actually.
Okay.
So what we do, we replace the eggs with young donors. We have egg banking system. So we take eggs from bank. So we replace the eggs with 25, 22 years old lady. Okay. So what we do, IVF with those eggs, and she will become pregnant. So that's possible only with IVF, not naturally.
Okay, then idu IVF no lui bank idu kan na sperm bank idu la this topic te man aral palwa discuss, but before that, since man menopause la area topic te thai she do mo la de aral continue karna hodo mun cha menopause la period. Okay, a person undergoing menopause, a lady, a woman undergoing menopause, like that, how can she take care of her health better? To apne alop in detail but janai do paro no, let's say tai kina or na tayo symptoms kiba gorcho grace because agide ko nishna pishi junba na chandi na menopause la, like even though she's going through the symptoms tahan do ito do mo thing bikai se mo ito hoy se inga lightly low paribo na mahan life de to, like symptoms we alop kiba ko na, like in a very God in simple words, the symptoms alop inga ko na tayla, how can we take care of it medically? Not everybody goes to a doctor. Bishipak to inga tayo na to ito doctor did naturally amni correct kinga or na ito la period to you can have a smooth period, and then even after that thing you can like natural lifestyle do takina ito la dalop kudo par
Lifestyle, I told you that she has to include calcium in her diet. So milk products, like she has to take milk, paneer, like that milk products, and those things that causes this contains rich content of calcium. Okay, she has to include. Another good thing is soybean.
Okay.
So soybean contains this estrogen. So in menopause we lose that estrogen, and that's why we have those kind of symptoms. Estrogen is depleted from our blood. Okay, so if she includes soybean daily, that will give her that estrogen content. That is phytoestrogen. From the beans we get it estrogen. Okay. So that will also relieve naturally her menopausal symptoms.
Okay.
And little walk in the evening will this relieve her insomnia, the sleep loss, like that, na? And a little activity.
Okay.
Little activity means walking is very good. So at least 45 minutes walk, like that. She will that will naturally will help to smoothen her menopausal journey.
Yeah, okay. So viewers, Dr. Lotte Mohan menopause la upar de kota krediksha or Dr. Roman ki janai dishi itu menopause to mohan symptoms ki thai ke ar dishi Dr. Lotte na jai ke na mohan nijor khor de kinga korna mohan la body ke take care kor parwo itu la upar de Dr. Roman ki janai dishi. To itu la next segment te ar mohan IVF conditional la topic upar kota krediksha do site te ki NLTV the doctor's life.
In the heart of Guwahati, by the Brahmaputra, Janitva IVF brings new hope to families dreaming of parenthood. With advanced technology, expert care, and personal attention, every journey is guided with love and trust, serving families across Northeast India and beyond, because every story deserves a happy beginning. Don't miss a Doctor's Live on NLTV, Saturday 5:30 p.m. with Dr. Arpita Sarmah, MD ONG, IVF Consultant, Janitva IVF Center. Learn about IVF infertility and the path to parenthood. Guwahati Guwahati thakia Janitwa IVF to bishi family nimite ekta nutun umid ase kunkan ama baba hubule sapna dikhi ase modern technology experts doctors aro bishi bhal dekhbhal logode idu suffer bharosa aro care bra borta ase Northeast India aro aspas laga desh tak seva kore kilimane sob kahani te ekta khushi laga shuruat deserve kore IBM kan in vitro fertilization aro parenthood laga journey phalbra jani bole Saturday 5:30 PM day Naglin TV ke join koribi Dr. Arpita Sarmah MT ONG IVF consultant Janitwa IVF Center Taibra IVF fertility treatments opor expert insights share kuriya honibo
Hello viewers, someone to get Naglan TV the doctor's life day wapas sagat kore mohan Dr. Arpita lokote fertility outreach de menopause kan opor de kota kore dekshe to idu kota de hi continue korina mohan Dr. mention kranishina IVF outreach de egg freezing na nishina topic opor de kota koribo idu topic to ajikali bishi young people majote bishi chuli se or bishi common nishina ekta ase to idu doc mohan huni huli man phal bana chane to doctor lokote idu opor de phal ba chani lobo So doctor, in continuation with that menopause, actually the situation is such that youngster or young people, they don't settle early, or even though they settle early, shadi koli bhi tan chuli family planning na banai. Then they are very career oriented as compared to family oriented. Iman noy career oriented thagi na to what itu situation there people go for freezing and everything. So what exactly is that freezing? Because freezing is all over social media, like young people they do like how we egg freezing crochet na lumo ito freezing crochet nga thake na, but then what exactly is that freezing?
Egg freezing is a very good option actually nowadays. So what we do now, we just put some hormone injections for 10 to 12 days whoever comes for freezing now, and they can actually better if they offer freezing at an early age. If this woman comes at around 40 and she tells that I want to go for egg freezing, the success will be very less for her, because by that time she will have very less number of eggs and her quality of eggs also will decline. If someone is opting for egg freezing, better she should consider in her early 30s. So that will give her a very good success rate. And what we do in this process, that we put her on injections which she can take at home also. So some hormone injections for 10 to 12 days, and then they retrieve her eggs under sonography guidance, and we freeze those eggs.
What is the procedure of going through this egg freezing or semen freezing? Like semen freezing bhi pare na.
Semen freezing is totally different thing. Totally different thing. When we talking about egg freezing, I told you now she has to take some hormone injections for multiple egg production. We need multiple eggs. Okay. So she will continue those injections for 10 to 12 days, and then with sonographic guidance, with little anesthesia, okay, for 20 minutes like that, we will retrieve her eggs under sonographic guidance, and those eggs will be frozen. Okay, and when she will consider for a baby like that, now, if she has frozen her eggs at 32 years, and now at 42, after 10 years also she is planning for pregnancy. So she will get the success rate of 32 years now, because IVF success rate only depends on female age egg. Okay, so she will get that success rate. So now the baby's complications will be less, the genetic abnormalities will be less for that lady if she plans her pregnancy at 42. So she will be carrying a very good success rate for that age, biologically is 32 years. At which age she has frozen her eggs.
So how early can a woman undergo for egg freezing, and what is the upper age, like what is the limit that like after this certain age you cannot go for egg freezing robot na parinolwi itu sal pungsishigulido from this age to this age mane itu the earliest that you can go for egg freezing and the limit
after 21
okay
she can freeze her eggs and before 40 after 40 we'll hardly get any eggs so it will be a kind of wastage of money like that now. So if she has an she is thinking over this thing now, egg freezing, and the earliest is better. And it is not like I'm young now, 25, I cannot. No, she can. She can freeze her eggs.
So what are the procedure that procedure to all explain condition man ke, but is it affordable to everybody? Is it like bishi thagina costly in terms of, let's say, monetary terms to kushili costly say egg freezing ekta?
So it will come around like this above lakhs, I mean 1.5 lakhs like that with all injections, the procedure chance, but there will be a kind of maintenance. So how long she wants to freeze her eggs, no, like that. Yeah, so there can be a kind of yearly maintenance she has to provide to the fertility this clinic to maintain her eggs like that. It's not one time thing that she frozen and she will come after 10 years. No, every year she has to maintain her eggs like that. There could be a kind of minimum fees to that.
So does it take I'm interrupting your talk, but then does it take a toll on the body of the women when you go through the egg freezing period, or does she have to face some challenges in her day-to-day life because of that thing?
No. Actually, the injection that she will be taking, she can take it home. It's a kind of pen and totally painless.
Okay.
But this 10 days period, she has to take injections, and in between 10 days, 2 or 3 days, she has to come for sonography to the fertility clinic to see the size of the eggs, and when we'll plan her egg retrieval like that. So anybody can do that, but yes, there is a certain, you have to go for this financial thing.
Yeah.
And nowadays this they get assistance from the bank also.
Yes.
There are so many schemes now coming up for this egg freezing, this IVF. So there's so many assistance is there, financial assistance they can take.
So amni do egg freeze kuishide. So do egg freeze kuina. How long can we keep that egg freeze kuina? Is there a
as long as she wants, 20 years, 15 years.
So there's
as long as she wants.
Okay, so there's no limit to that thing.
The egg will remain in that stage unless we take out from this frozen state, na, and it will remain at that stage.
Okay, so one egg
even I'm just interrupting. If a young girl, suppose, is diagnosed with ovarian cancer, okay, and she is post puberty, 16 years, like that. And once she is diagnosed, certain ovarian cancers are very common at young age actually, 16, 17, like that, post puberty, okay. So those kind of girls will become sterile. They will not become pregnant if they are not. We do not preserve their fertility ovarian tissue, because they have to go for chemotherapy, radiotherapy after the surgery. So they will become sterile. So what we do nowadays, this onco-fertility has come up. So what we do, we preserve their ovarian tissue also. So as they are very young, we cannot make them just take these injections and all. No? So what we do, we preserve their tissue, ovarian tissue, those forming eggs, and we freeze them. So those things also coming up. This is onco-fertility for the cancer patient also. So this is very important indication. One is social indication, that we are talking about that we are delaying our fertility. But one important indication is cancer actually. So if you are diagnosed with breast cancer or no, so you can freeze your eggs and then you can plan the fertility. But once you are diagnosed with cancer, this chemotherapy and radiotherapy will make you sterile. You cannot become pregnant after that. So this is very important indication of for egg freezing in women actually.
To viewers, mohan Dr. Arpita Lote kota kridek she or tayo mohan ke menopause law purdu janai di she aru she egg freezing law purdu janai di she mohan most of the times mohan bishi case de to egg freezing to mohan very career oriented thaka karne mohan choose kore mohan ekta option ki like okay mo ita family plan na korbo koi na mohan lai de choose ke, but career la site in only social area de hi no na sometimes it do health la site we egg freezing do thake but those are very good options ajikali la time de we are medically man advancement we should do kan the powerful options kan aise to Dr. Rahman ke mahan jane hunishe hulu man la edukan upor de detail bana jani na man thake to hulu man doctor lo de pal opportunity de edukan kota upor de kota koise to edu nishina hi aro alak bishi ase Dr. Rahman Jasper banks sperm freezing nishina bishi ase edu nishina hi alak bishi ase sperm bag no liwe sperm freezing nishina bishi ase hulu man phal bana jani to edukan upor de aro man kota korbo next episode de the site with NLTV the doctor's life.